Good afternoon, Chamber members. For those of you I haven't met yet, my name is Sabrina Binkley, Head of School for Spruce Tree Montessori and Chair of the Fairbanks Chamber Board of Directors. I'd like to take a moment to thank our executive partners, whose logos you saw on the screen just before we began today. Those members are the backbone of the Fairbanks Chamber's advocacy efforts, and we're so appreciative of their partnership. A full list of our executive partners can be found on our website. We would also like to give a special thank you to Alaska Universal Productions for sponsoring today's presentation. We are grateful for the continued support of our member businesses who help us make these presentations possible each week. We'll hear from them later in our program. Right now, I'd like to welcome Brenna to help us recognize our new and renewing members. Brenna?
Thanks, Sabrina. We'd like to welcome a new member today. Gunderson Painting has joined the Chamber this week, and we're very excited to have them on board. We'd also like to welcome a new executive partner, Ambler Metals. We look forward to working with both of you in the future. We'd like to thank Alaska Executive Search for renewing their executive partnership, and we'd also like to thank the renewing members below. University Chevron, Youth Sports Bingo of Fairbanks, and Page Sculpture Studios. We'd also like to thank our 110% Club for going above and beyond their membership investments. Gem Company, Equinox Physical Therapy, Guardian Flight, and Dowell. Thank you for all that you do, and we're very appreciative of your support. And today's Member Minute is all about participation, whether that is participating in a fun new virtual event that you haven't tried before, or participating in a survey to help organizations gauge the impact of the local epidemic. This will help them then create a plan towards recovery and will help them implement that plan to make sure that it covers all industries if they have the correct information at hand. So we encourage you this week to participate. Back to you, Sabrina.
Thanks so much, Brenna. The Fairbanks Chamber Board of Directors and staff are currently discussing our role in the economic recovery process that lies ahead. We recognize that in order to ensure our economic health, we must also be mindful of our community's health. We've received some fantastic feedback from our members so far and encourage everyone to engage with us as we advocate, promote, and develop for the businesses throughout this recovery process. We're also grateful for the relationship we have with our friends at Foundation Health Partners and the healthcare expertise they share openly with our business community. This morning, our Government Relations Committee put the final touches on a resolution to support development and investment in Alaska. This resolution will go to our board at our next meeting on Monday, April 27. And now it's time for our President and CEO report by the lovely Marissa Shera.
Thank you, Sabrina. Real quick, just want to let folks know that our Chamber team is working on bringing our members some fun new virtual events that we'd love to see your faces online for. The first one is tomorrow, and it's called Coffee Talk. If you're looking for new ways to connect to the community, bounce ideas off of one another, share learnings and strategies from your work recently, then this is for you. Grab your morning pick-me-up and join us tomorrow at Wednesday, April 22nd at 10 a.m. for some lively conversation and friendly faces. You can find this event and participation link on our event calendar in yesterday's edition of The Scoop, or you can email Katie for more information at katie@fairbankschamber.org. Then next week, we'll be hosting a happy hour for some laid-back fun. We'll be rolling out the details later this week, but go ahead and mark your calendar now for Thursday, April 30th at 5:30 p.m. for a happy hour with your Chamber friends. For our first happy hour event, we're going to be playing virtual bingo, so make sure you tune in for that. Also want to let folks know this is breaking news. We're super excited to announce that today, Eielson Air Force Base is welcoming the first F-35 Lightning IIs here to Alaska. This is an exciting event, and it will be available via live broadcast at KTVF Channel 11. You can see that on television, or you can go to their website, which is www.webcenter11.com. That event is tentatively scheduled to begin at 2:50 p.m. when the aircraft are anticipated to arrive. But as always, please note that weather and travel delays may occur, which could shift the timing slightly. We do have a post up on our Facebook page, and we'll make sure that we post any updates about major delays on our Facebook page, and I'm sure that you can tune into our friends over at KTVF Channel 11 as they provide coverage for this event online. I also want to ask businesses, if you're getting creative with any of the services that you provide, if you're partnering with other member businesses to provide additional support to our community or local organizations, or if you're doing different things like taking events virtual or changing your business model, we'd like to know what you're doing differently in these times, and we'd love to help you share the news through our Members on the Move section of our website and our newsletter. You can email Brenna or Katie information, and we can help you share the word. As Sabrina mentioned earlier in her comments, the Chamber is eager to participate in the economic recovery process, and I'd love to hear thoughts from our members and answers to the following questions, or if you have other ideas that you think are important for us to consider as we navigate the road to recovery. So some questions that I have for food for thought are, what does your sector need to get on the path of recovery? What do your clients or your partners need? What will it take for you to reopen your business and or return to your normal hours of operation? How do you anticipate that your business will adapt to our possible new normal? And what do you need from our local, state, and federal elected officials to make this list? If you've got ideas or answers to any of those questions that you'd like to share me, I encourage you to do so. My email address is Marissa, that's M-A-R-I-S-A, at fairbankschamber.org. And I welcome your thoughts and suggestions. And finally, I just wanted to let folks know that we are keeping tabs on the development of additional funding through the CARES Act for the Payroll Protection Program. Make sure that you keep in touch with us for updates as they become available, as we know that not everyone was able to leverage funding through that program, and there's still a lot of needs to be met there, and we are hopeful that we'll have more information in the coming days or weeks. You can find information about all of this and more at our website at fairbankschamber.org. Thanks so much, and back to you, Sabrina.
Thanks, Marissa. Now it's time for our main presentation. The Fairbanks Chamber has been communicating with our local healthcare leaders to keep our membership and community abreast of the most current updates. We are happy to have both Dr. Simon and Dr. Bruner with us today to inform us about the latest ways to keep our businesses and our community healthy and safe. Dr. Mike Simon is an emergency medicine residency trained board certified emergency physician. He earned his bachelor's degree from Drake University in Des Moines, Iowa. He earned his medical degree from the University of Iowa College of Medicine in Iowa City, and he completed his emergency medicine residency at the University Healthcare Center of Pittsburgh. Professional memberships include the American College of Emergency Physicians and the American Academy of Emergency Medicine. Dr. Laura Bruner is the medical director of the NICU and inpatient pediatrics at Fairbanks Memorial Hospital. She is also a pediatrician at Tanana Valley Clinic. She specializes in pediatrics and considers it a privilege to participate in children's health care in our community. She attained her medical degree from the University of Minnesota Medical School and an undergraduate degree from the University of Minnesota College of Biological Sciences. Dr. Bruner enjoys cooking, the outdoors, and spending time with her family. She received her medical education from the University of Minnesota Twin Cities Medical School, did her internship and residency at the Children's Hospital Colorado at the University of Colorado, and is a board certified by the American Board of Pediatrics. Now I'd like to welcome Dr. Simon to get our presentation started. Dr. Simon?
Thank you, Sabrina. Hi, this is Mark Simon, and I'm an emergency physician at FMH. And before we go too much further, I just want to introduce Dr. Bruner, who's here in the room with me.
Hi guys, I'm Laura Bruner. Nice to see you.
So to start, we want to thank the Chamber for recognizing the importance of this work and giving us the opportunity to have this conversation. We're excited to start off by talking about a resource we are offering to a local business to help decrease the risk of COVID-19 transmission within our community and specifically within our businesses. As business leaders, I appreciate you taking the time to engage in this discussion. Next slide, please. The program you are going to hear about today is a collaboration between community providers and FHP, and I want to highlight the efforts put in by these individuals. A group of community providers saw the important role that business could play in mitigating disease spread in our community and collaborated with FHP to build this program that we're going to talk about today. I want to specifically mention Dr. Lessner and Dr. Hoganson from Chena Health, Dr. Panko from Radiology Consultants, Suzanne Jones from TCC, and Dr. Ashley Strum, Kate Carey, and Jen Rebar from FHP. And of course, Kelly Atley and the PR team from FHP were in putting all this together, and they helped take an idea and turn it into a reality. So appreciate everyone's work on that. Next slide. And we're going to skip this. Dr. Bruner is going to touch on this slide in the next slide. Good, and one more. Good. So why are we talking about this? And the reason is pretty simple. COVID-19 is in our community, and the most important thing any of us can do is to decrease the spread of COVID-19. Next slide, please. So why are we? Why does it make sense to partner with a business? And really, there are three reasons why we thought this was a good idea. The first reason is the simplest and most obvious. That's to protect you as a business, to protect your employees, and to protect your customers. We know that the most important thing we can do to limit the harm that COVID-19 has on our community is to minimize disease transmission. And disease transmission occurs when people are close together. And that happens either in our homes or in our places of business. And so this partnership is designed to help minimize disease transmission in our local businesses, which will protect you, your employees, your customers, and our community. The second reason why we think this partnership is valuable is because as business leaders, you're not only viewed as leaders of your business, but also as leaders of our community. You and your businesses are looked to for guidance in uncertain times, and that is now. By being resources of trusted information, as well as modeling desired behaviors, our community members are more likely to hear and embrace the pertinent public health messages. It's our hope that local business leaders will amplify these keep our community safe messages so that we can get more of our community to embrace these public health measures for the good of all of us. The third reason why we think this partnership is valuable has to do with the future. We don't know what the future holds. And as we have all become acutely aware over the recent past, our world can change quickly. And as the world changes, whether it's related to COVID-19 or some other event, we feel that having a strong relationship with between our healthcare community and our business community will enable us to be as nimble as we can be for whatever lies ahead. Next slide, please. So in terms of benefit to business, to your business, I think a lot of them are fairly obvious. Again, keeping your employees healthy is vitally important. I wanted to take a minute to talk about customer confidence. I think that increasingly we will see this aspect play out in our community. Increasingly, I think we will see businesses being judged a little bit for not necessarily embracing and living public health recommendations that have become a part of everyone's consciousness. Recommendations around the use of homemade masks, recommendations around hand and face hygiene and social distancing. I know that in my own personal conversations, I'm increasingly hearing people come on different business practices and how that affects their likelihood to either go back to that business or choose to go to another business where they feel like the public health practices are being more fully implemented. And obviously, we all want to keep our community safe. Next slide, please. So what we are doing is we have developed two resources for you. The first resource is a toolkit, and the toolkit is available on the FHP website. And the toolkit has multiple PDFs available for you. The PDFs come in two basic flavors. One flavor is designed to be used as a sign within your business to describe what you are doing to help keep your employees and the community safe. And they also can be thought of as signs to help nudge, encourage the public to also adopt these practices. The second group of PDFs we have available on the website are tip sheets, and these tip sheets have more information and are designed to provide you and your business with information to help you protect, again, your employees and your customers. The second resource we have for you is the opportunity for a visit from a local provider to help you incorporate these public health recommendations into your business. These are providers who recognize the important role you and your business play, and they are providers who are willing to be creative and a creative resource for you to help bring these public health measures to life. The public health measures that are included in our toolkit, I suspect, are familiar to all of you. They are the messages of stay home, wear a homemade mask when out in public, the importance of hand and face hygiene, and the importance of social distancing. Next slide, please. So I wanted to now go into a little bit more detail about each message. You can see some of the PDFs on the presentation. The first topic is masking up and why mask ups. And the main purpose to do that is for protection. And again, the thinking is that my mask protects you and your mask protects me. And we are talking about the use of homemade masks here, not medical grade masks. And the main reason for the homemade mask is to, again, protect those around you from you. We know that when we talk, when we laugh, when we cough, we emit tiny droplets. And these droplets can contain infectious virus. We also know that people with COVID-19 can have very mild symptoms or no symptoms at all, and yet they can still transmit the infection to others. And this is the reason for all of us to wear a homemade mask when out in public, to limit the number of droplets each of us emit, droplets that can contain the virus and potentially infect those people around us. Another reason why we think wearing a mask can be positive for a business is because a mask is a very visible way to send a message to customers, a message that says that you care about them as individuals, that you care about our community, and that you are taking this seriously. You are saying, I'm doing everything I can to keep you safe and to keep all of us safe. Alternatives to traditional masks, so there's not an unlimited supply of masks, and anything that provides a barrier between your nose and your mouth and those around you can serve as a mask. So that can be a neckie, a scarf, a balaclava, a shirt. There are lots of creative ways to create a homemade mask. And then there are several resources in town to get masks. Facebook is a widespread area. The Fairbanks ACC website, if people have not been there, I encourage you to check it out. That is our local interior command center, and there are a lot of local resources available on that website. And then there's an email account, communitymasks@gmail account, where you can also ask for assistance in getting masks. Next slide, please. So this, I think everyone has heard the stay home message, and we appreciate that. I wanted to talk more specifically about the sick workers should stay home message, because that's something that's a little bit different and a little particular to you all as business leaders. In the past, it was seen as a sign of dependability, courage, toughness, all positive features to go to work when you're feeling a little bit sick. And now is not the time to be doing that for the reasons we stated before. Due to the ease of transmission of this virus, we really encourage all of our business leaders to not only understand that their employees should be staying home when they're sick, but also to proactively message to their employees that you really want to hear from them if they're feeling unwell at all. Because again, it's important for everyone if they're sick to stay home at this time and limit exposure to other people in our community. Next slide, please. So the next topic we have is social distancing. And when we do our presentations and discussions with different businesses, I would say this is commonly the area where there's the most opportunity for flexibility, because every business is a little bit different. The flow of their workers, the flow of their customers is different. And so we often spend a lot of time discussing this, looking at their business model and trying to figure out how we can maximize and empower the social distancing piece. On this graphic, we pretty much divided up into two groups. One is things that you can do as a business to decrease people even coming into your business. So that may be curbside pickup, workers doing distance work, lots of different creative ways to do that. The second tool we have is, okay, now assuming people are in your business, what can we do to minimize the opportunity for them to violate that 6-foot barrier and or just come in contact with people? I should say whenever we talk about social distancing, we highlight the fact that the kryptonite to social distancing is common spaces. And so if you and all of your employees do a perfect job of staying, let's call it 10 feet away. If you stay 10 feet away from people at all times, but yet you go back to some central space, whether it's a counter, whether it's a door handle, whether it's a shelf, and if you have the opportunity for secretions to be spread between people from that space, then it doesn't really matter if you stay 10 feet away. You could still have the possibility to have disease transmission occur within your business. So recognizing the power and the risk of those common spaces is really important. And we talk about that whenever we talk about social distancing. Next slide, please. So next we have hand and face hygiene. I think most people are well aware of this. So the take-home point here is that our hands are often the vehicle to spread the germ, and our face is the entry point by which the germ gets into our body. So hand hygiene is very important. We really stress that. Face hygiene and limiting the amount of times people touch their face, we really stress that. And what we stress more than anything at all is if you do have to touch your face, that you make sure you washed your hands immediately before that, for the reason that in case you had come in contact with any infectious particles, you're going to get rid of them at that time. Next slide, please. So those 4 messages we just talked about are the four categories of public health messaging that are both protective to our community and that we're pushing with across our community, including with our reach out to local business. This is the hotline, local hotline for more information about COVID-19. The state has its own hotline at 211. These are both good resources of information for you. Next slide, please. Some additional online resources. So the CDC is a trusted resource, and the state of Alaska DHSS is another fantastic resource. I suspect many of you are familiar with these already. Next slide, please. Again, we have 2, just to highlight what we've delivered. We have 2 opportunities for you in terms of accessing signage and informational PDFs on the website, and then the opportunity to have a provider come visit your business and offer feedback and just have a conversation about different things to think about. We certainly don't have all the answers. We are by no means a judge or a jury. We are here to be a resource for you as you think about opening up your business and changing your business. So again, I just wanted to, as I wrap up here, extend my appreciation to all the partners involved in creating that, from China Health, Radiology Consultants, TCC, FHP, and TVC. And again, thank the Chamber for the opportunity to have this discussion. We hope you found it useful, and we hope to have much more conversation about this over the next 30 minutes and over the next days, weeks, and months. So thanks again. And with that, I will turn it back over to Marissa, Katie, or Sabrina, or whoever else. So thank you.
Sabrina, you're on mute.
All right, thank you so much, Dr. Simon, and thank you also for your support, Dr. Bruner. We are not only pleased to serve as your partner in this communication, but I'd like to announce that we would like to help take the lead on getting this message out for not only the doctors and partners that help put it together, but in an effort to help better serve our over 700 member businesses. So we would like to support this effort in any way that we can for the weeks, months, and years ahead as needed, in order to be very mindful of the ongoing well-being in Fairbanks. So members, the Chamber is ready to help you get these messages out. If you'd like your logo added to any of these documents for your place of work, please reach out to the Chamber office. We can do this together. So now I'd like to invite John Huff of Universal Productions to present his sponsor spotlight. John?
Thanks, Sabrina. Here at Alaska Universal Productions, we're happy to partner with the Chamber just to bring these luncheons or presentations to you. We think that it just helps with bringing kind of some normalcy to everyone's lives because we're all in the routine of the weekly luncheon. So I think that's a good thing for us. This pandemic has definitely impacted AUP. Most of our staff was laid off, but we are bringing those guys back at the moment. Most of our live events have been postponed to the fall, but we are bringing a lot of those online. So we're working with all of our clients to see what we can do to bring either their live event online or also just bring their annual meetings virtually. Most recently, we set up virtual broadcast centers, kind of like here at the Chamber. I'm sitting here alone in the Chamber office with great internet, and we switch between all the cameras and bring the presentation to you. We've helped multiple churches across the state either bring in a full online social presence or upgrade their system to bring the presentation better to their congregations. We're also working with organizations on their annual meetings, such as going on. We're helping GBA here soon with their annual meeting, where we can no longer meet, the 1,000 people at Herring Auditorium, but now we can do it online, virtually. New products, we do have webcams coming in. They are back ordered across the entire country, and we have a small stock coming in the next week or two. We also have video switchers for those churches or organizations that want to do the production on their own. And we can help train, consult, or provide the equipment for this. That's all I have. Thanks, Sabrina.
Excellent. Thank you, John. So we're going to go now back to the doctors. They have a short video to share, as well as I wanted to remind you, if you have any questions, you can chat those through the live stream, and then we will have Q&A shortly following. Thanks so much. Back to you, Dr. Simon and Dr. Bruner.
Marissa, video to play.
Hi, I'm Dr. Andrew Ramirez, Quality Medical Director for Foundation Health Partners.
And I'm Dr. Laura Bruner, and I want to talk to you about modeling. Modeling is the concept of trying to predict what COVID-19 may or may not do in our community. This is similar to a weather prediction. We all check the weather prediction and then try and prepare for the next day or two to be ready for what is going to happen. The difference with infectious disease modeling is we're not only trying to prepare, but we're trying to prevent and prove the models wrong. We've all seen predictions and curves that show hospital capacity being overwhelmed very quickly in our state and in our world. I want to take a moment and say thank you, Fairbanks. Because of the work that you've done, we've been able to avoid being overwhelmed in our hospital capacity here in Fairbanks so far. We have slowed the spread. You have been a part of this. I want to take a moment and walk you through one model that is using Fairbanks data. You can see on the graph on the bottom is date. So it starts in March and it goes through September. The solid black line that you see along the bottom is how many hospital beds that we have available here in Fairbanks. The big increase that you see is the addition of the Carlson Center. The lines that follow along, the red line is what we expect to happen with COVID-19 hospitalizations if we hadn't done anything, if we hadn't done social distancing or shelter in place or mask up Fairbanks. The blue line that you see is what we would expect to happen with social distancing alone. And the yellow line is with shelter in place, and the big increase is once shelter in place is lifted. The dotted line is what we see happening with our Fairbanks data right now. What this shows is that we are still at risk for a surge in Fairbanks. That this surge is affected by a number of things. This includes tourism, this includes how we all change our behavior over the next weeks and months, and as we start interacting together more as a community, we are still at risk to overwhelm our healthcare capacity. Each one of these things impacts this in a different way, and we can't predict the future. What we do know is that in Fairbanks, if we do have a significant increase, we can still overwhelm our capacity even with the Carlson Center. As we enter this next phase, our goal as a community is to prove these models wrong. Our goal is to prepare and prevent and work together. This prevention is within our control. Once again, I want to say thank you to Interior Alaska for all that you've done to help shift these curves and help us not overwhelm healthcare capacity so far, and that we can work together as a team to continue to move towards a new normal for Fairbanks.
In Fairbanks, on March 16th, we announced our first 2 COVID-19 confirmed diagnoses. We had our first patient hospitalized with COVID-19 shortly thereafter. On April 3rd, Fairbanks experienced the first COVID-19 related death. We had an outbreak within our long-term care facility, Denali Center, and we had a cluster within our community. The term hotspot was used to describe what was occurring in Fairbanks. We also had healthcare workers test positive and or who were quarantined due to exposure. Today, 1 month later, in Fairbanks, we have no new COVID-19 diagnoses in the past 4 days, and only 1 new diagnosis in the past 6 days. As of today, we have truly flattened the curve within Fairbanks. Flattening the curve did not happen by accident. Suppressing the spread of COVID-19 virus within Fairbanks was the result of hard work by many on the front lines of this crisis. The healthcare entities that are part of the Unified Command, the entire medical community, including the private sector, our first responders, and countless community partners who have collaborated to create safe practices and to support those on the front lines. Suppressing the spread of the COVID-19 virus was the result of contributions of those in the public who have sheltered in place, our business community who have sacrificed much to support the sheltering in place, those who have practiced social distancing, as well as those who are wearing cloth masks while out in public. Flattening the curve is not something any of us alone can accomplish. It only happens if we are all working together. At this point, it is tempting to think that since we have flattened the curve, now life can get back to normal. The reality is that we are in the midst of a global pandemic and have a new normal ahead of us. COVID-19, the virus, and the disease due to it has not changed. We still have no immunity, no vaccine, and no disease-specific treatment. COVID-19 is highly contagious and has the potential to spread like wildfire through our community. COVID-19 still has the potential to overwhelm our healthcare system. To protect our community, our new normal will require continued change of all of us. As a healthcare system, Foundation Health Partners is prepared to care for COVID-19 patients and to do so safely. As always, we are prepared to care for non-COVID patients. And as a part of our new norm, we are also ready for a surge of COVID patients because the risk of exponential growth is real and has not disappeared. As a community, our new normal requires us to continue social distancing measures this year. We need to continue to wear cloth face masks when out in public. We need to practice social distancing of staying 6 feet apart. We need to avoid large gatherings. These measures are a part of our new normal and will protect our community from the rapid spread of COVID-19. Working together, Fairbanks and the interior can continue to be strong and healthy even as we live through this global pandemic.
Hi guys, I'm Laura Bruner. Thank you for allowing us to play that video. And I'm here, Dr. Simon and I are both in the room. And so we wanted to open it up to any questions that you guys may have about any of the information that we've shared today.
Wonderful. Thank you so much. And Janelle, would you go ahead and start the questions?
Will do. We have a few that have come in online. Actually, quite a few that have come in online. So one question about, particularly, you had mentioned if there are central locations in an office that everyone tends to go back to and might be touching things in that location. Should people who are still working in an office be concerned about paper, printers, are there particular objects within the office they should be particularly concerned about? And are there some where you might not need to be as cautious?
No, I would say that anywhere that, again, the main way that this infection is transmitted is from secretions. And again, those secretions tend to come from our nose or our mouth, and then they get somewhere. So sometimes they get onto our hand and then we touch something, or sometimes they're in a location and then we touch that and then we touch our face. So I think you can think of, I think at this time, the safest thing to do is consider anything that you're touching has the potential to be risky. So if it's paper, if it's a copier, if it's a coffee pot, if it's a door handle, to just recognize that, again, if you have people coming to the same space, that presents an opportunity for transmission. And the best way, obviously, to mitigate that risk is by cleaning, cleaning those surfaces frequently. And if for whatever reason you can't, if you're in that circumstance, really the last line of defense that everyone has is washing your hands before you touch your face. So we think of all these things as on a spectrum. And getting to Dr. Bruner's point about, and what Dr. Ramirez brought up about the importance of all these measures, staying home is the most powerful measure we have. If you don't have people come in contact with each other, the disease doesn't spread, period. It's very easy. As we move forward in this, the other things we can do become more important, because once people start engaging in business again and living their lives again, then the messages of masking and hand and face hygiene become really the only tools that we have to help protect us. So again, I think it's just important to know that cleaning surfaces as much as possible is important. If there is common space, minimizing the amount of contact you have in that, but at all costs, if those things do happen, and they may happen within a business, then people just need to know that the critical step is to wash their hands before they ever touch their face.
Okay, thanks. There are a few questions specifically about testing, so I'll kind of try to categorize them here. I think the first kind of category is is there any concern at this point that people are choosing not to be tested, even if they have some of the symptoms, specifically within the Fairbanks area?
I think, ideally, everyone, so testing is important. Testing is really important from a public health perspective. It's really important to know the amount of disease burden within our community, and that allows all of our experts to do the jobs that they do in terms of tracking this disease and giving the best recommendations we can give in terms of kind of the things we're talking about. When does business open up a little bit more? On an individual basis, the test has a little bit less importance so long as people assume they have it and they stay home in following the CDC recommendations of how long you should be home. So again, on an individual basis, if someone chooses not to get tested, and sometimes people can go to a doctor and they may not be tested for any number of reasons. But what is important is that that person assumes they have it, they stay home, they isolate, and that they social distance from their family in ways to help decrease transmission to their family members.
Okay, and I think many of the other questions about testing kind of fall under the general category of how many tests are we doing in Fairbanks and when will we be getting the antibodies test? I think people are very interested to know, when are we going to have those things happening more?
That's a great question. So I think we've read a lot about all the different types of testing in the news all over the country. So right now we do have in our community, from a number of sources, plenty of testing materials. So at various time points you've heard we don't have enough kits or swabs or those sorts of things. We do have enough testing materials at this time point to take care of Fairbanks. There are two other types of tests that a number of providers in the community are actively pursuing having. So one is a rapid test, and Tanana Chiefs Conference does have some availability of that test right now. And we're hopeful that Foundation Health Partners will have that shortly, but the time frame keeps changing. So we will see with that. The antibody testing, there are a number of different types of antibody testing available. And we are actively pursuing those. We're hoping that we'll have something here within the next weeks, but there are a number of them available, and it will depend on suppliers nationwide.
Okay, thanks. Specifically kind of a business related question for businesses that do wish to remain open. Do you have any thoughts about the effectiveness of a plexiglass barrier? Is that something that could be effective at protecting employees and customers, or is it better just to stay closed?
You added that little piece at the end, which makes it a trickier question to answer. So I won't answer which is better. I think that's up to every business to decide whether they're it's not up to me to decide whether a business is open or closed. But I will say that the plexiglass barriers are fantastic. And I think most of you have probably seen them at various stores. I was just in I think I can say this. I was just in the post office, and they had a very low tech, they had 2 2x4s on the table, and they had looked like they cut with a little skill saw, a little groove in them. And then they just put their plastic barrier sitting in the 2x4s. And so there are lots of creative ways to create a barrier. But yes, the plexiglass barriers is, I would say it's kind of a no-brainer for business. You know, whenever you go to pay or have an exchange, almost by definition, you are violating the 6 feet of social distancing. And it is a great way to make sure that the secretions of the attendant stay away from the customer, and that the customer's secretions stay away from the cashier. So yes, that is again, in my mind, I would say that's a no-brainer for the checkout process, and any process where you're coming face to face with the public.
When you mentioned the 6-foot rule, so we do have a question specifically about that. For example, in a typical office space, you might have folks with their own desk in a large office where they are sitting more than 6 feet away from each other. Do you have any recommendations for that type of situation?
So I'm glad you pointed out that I said the word rule. So 6 feet is a guide, and we know that that more space is better. And it also has to do with how much activity, how heavily people are breathing. And again, there is no magic number. So if you were in let's say you were in a gym and there were multiple people exercising, I would want more than a 6-foot barrier. I can't tell you what that number is. I would just tell you that that I would want more, because in that setting where you have people exercising and increasing the amount of particles they're putting out into the air, that you would want more than one every 6 feet. So I don't know that I can answer. Again, if that person wants to reach out to us, we can certainly come take a look. I think again, there's no perfect, and everything, all we're trying to do is get better. And I would think about it as the fewer people per area of space, the better.
Great. And I think people definitely will appreciate that offer of to come and take a look, because I know a lot of us are trying to figure out how do these things apply to my specific situation. So that's great. So a couple of questions that are related here. Someone's asking about, if we go 14 days with no new reported cases, will it be an appropriate time to start relaxing some of those social distancing policies? And I think it's related to ask, so do you all have any recommendations or plans for, once that opening does start up, how to handle some of that risk that's going to be inherent in having more people in the same spaces again?
I decided to take this one because it's easy, and I would say no. That is no answer there. Like, that is I would say a political and a governmental and a public decision. I will say a couple things that I just wanted to offer. This is new for everyone, and so everyone is learning as we go. And as I've listened and read about people who are much smarter than I am about things that help protect our community when faced with something like this, and really what has resonated with me is three items that seem wise for a community to have when dealing with something like this. And the first, Dr. Bruner brought up, which is rapid and accurate testing. And I say rapid and accurate together because they don't always go hand in hand. I know that a lot of times people think that everything in healthcare is 100% accurate, but unfortunately that's not the case. So what we really need is one, rapid and accurate testing. Number two, what we really need is a sufficient public health resource to be able to do what we call contact tracing, which is identifying those people who have been potentially exposed to COVID-19 and making sure they get quarantined and appropriately followed for symptoms. And then the third thing we really need is an identified trigger and an ability to track disease, so that when when our disease burden gets high again, we know it, and then we have a plan for what to do about it, which in general is going to be, again, reaching out to the public as we did this go around and say, hey, it's time to scale back. So I think we all want to get back as much to life as we know it, and our community leaders will navigate that process. I think, again, the thing as a person in healthcare wants to really make sure everyone thinks about, asks about, and maybe even demands is that we have rapid and accurate testing to be able to most safely open up, as well as a sufficient public health resource to be able to appropriately deal with the increase in disease that we'll no doubt see once people start resuming their normal behavior.
Okay, thanks. Oh, go ahead.
Sorry, I did just want to add one thing on there, and that is echoing what we've said already, which is just a huge thank you to the Fairbanks community and Interior Alaska. When you look at the curves about case numbers that are available, the work that Fairbanks has done to flatten this curve is really unbelievable. And that's all the sacrifices that have been made here. That being said, echoing Dr. Simon, we remain in a global pandemic and we don't have a playbook of exactly what decision do you make when. And so as we see things change, we're all going to have to maintain our flexibility to be ready to change again.
And actually, sort of to tag on to that a little bit, there was a question online about, are we hearing any more about the possibility of double infection, whether someone can get this, a second time? And I know there's been some controversy over whether that was the relevant information that was kind of going around.
Yeah, I think this is a really hard one. It's been in the news a lot lately, and I think the bottom line is we don't know. That there are some concerns about could you be reinfected again once you have it? Do you have protective antibodies afterwards? And really, the science and the data that we have is we just don't know.
Okay. And there was a question about how to contact you all if someone does want to request a visit. I am actually looking at the FHP website. I don't know if you want to tag on to this, but it does suggest that people email to fhpcommunityfeedback@foundationhealth.org. So I don't know if there's anything you want to add to that.
Yes, that is the easiest way to ask for a visit.
Okay, and I think we have time for just one last question, which I think we've covered most of what was out here, but did you have any, or would you have any specific advice for summer or seasonal businesses as they're starting to think now about opening up for the summer? Are there any particular precautions that you would recommend?
I really don't. It's really too broad a question for me to answer, I guess, in this forum, and the future is really uncertain, and so it's just hard to predict. We're happy to engage one-on-one. There may be a little bit further, again, depending on the business, things we could say to think about, but it's really hard to know. It's hard to know where we'll be in 3 days, and it's really hard to know where we'll be in a week or a month or 4 months. So, I think that's the best we can do at the moment.
And I was just going to throw it out there that I've got my donut-covered mask ready to go out the next time I need to go out in the community. Since I'm home by myself, I'm not wearing it, but I'm ready. So back to you, Sabrina.
Okay, I love that fabric. Janelle, nice. So thanks again, Dr. Bruner. So good to see you. And Dr. Simon, great information, very thoughtful. We will, like I said before, do our very best to support your efforts and produce documents with employee logos, or should I say business logos, if businesses are interested in that, and we can get those out to businesses after you've contacted Marissa or her staff within the Chamber office. I wanted also to thank John Huff again for not only his sponsoring of today's presentation, but for helping us to provide these presentations on a weekly basis for the last several weeks. As you know, we've been coming to you live from our homes and physical distancing ourselves, as Laura Bruner said, to model a healthy community collective effort against this pandemic. So I appreciate John's help, and I appreciate all of you out there who have continued to interact with us this way and support these general membership luncheons. I can't get away from saying luncheons, so I guess I should say the food's been great, right? For those of you who have come to our luncheons before, I would say that it's Takeout Tuesday, and again, ask that perhaps you consider supporting one of our local restaurants. The restrictions have been lifted a bit for delivery and takeout service, including bars and breweries. So I would consider maybe purchasing takeout tonight on Takeout Tuesday. The other option is we are still encouraging a donation to the local nonprofits working hard in our community to support those in need during these challenging times. We also appreciate your continued participation, and next week's luncheon will be Amy Vinlove of the UAF School of Education, and she's going to present how they are preparing teachers for Alaska's future. A friendly reminder that the ETA of the first F-35 is 2:45 p.m. today, and it will be live streamed on KTVF Web Center, I believe their Facebook page. So tune into that. It's quite exciting. And again, just stay in touch with us via our website and continue to look over the Scoop, which is our weekly newsletter for information on luncheons, advocacy, and updates. Thanks again, Fairbanks. Be well.